And so I'll just share the slides.
Is doctor audible to all of you? Because I found a little disturbance in the audio.
Am I audible?
Can you all can kind of some of you can unmute and confirm?
Yes.
Yes, yes. Okay, good.
Okay.
Just a note before doctor gets started. If you have any questions, we will not stop the flow when doctor speaks. We'll keep ourselves muted and let him finish the presentation. You may meanwhile, choose to park your questions. Anyways, we will have a Q&A session as soon as he finishes the presentation. Thank you. Over
Yeah.
to you,
Thank you,
doctor.
Mr. Pruning. Yeah. So once again, good evening, everyone. So basically, so we want to study about gut dysbiosis and autism, and what does exactly gut dysbiosis and how it is related to autism. So we'll try to figure out in this presentation. So what we'll be discussing, just an overview slide, what we'll be discussing in this presentation, what exactly we mean about gut microbiota, how it is important, what is dysbiosis, what are the factors which affect gut microbiota, and how. So factors affecting gut microbiota, how gut microbiota affects the brain functioning, and what is exactly gut-brain axis. This I have put up because before going to the gut dysbiosis association, we should know what exactly these terms means, and we are able to figure out these terms. Probably we'll be able to figure out the relationship between gut dysbiosis and autism. Just am I visible? Yes, yes. Just a minute. The slide is not moving.
Okay, no issues. We'll wait. Take your time. Do you want to close and reopen and reshare?
Yeah. Just, yeah.
Good.
So coming to our introduction, so why we want to basically study about gut dysbiosis. See, gastrointestinal symptoms or what we call as GI symptoms, they are the most important comorbidity which are associated in children with autism. And literature says that around 20 to 25% of the kids with autism, they have GI symptoms. And there are a lot of studies are there which have shown that the alternation in the composition of the fecal flora and the products of gut microbiome are important patient with ASD, and how they play an important role the gut microbiota. It influences the brain in lot of ways. There is a connection what we call as gut brain axis that we'll be studying in our future slides, and this gut microbiota interacts with the human brain through endocrine, means to say through hormones, through nerves, and through different mechanisms or what we call as neurotransmitters. So whenever there is an abnormal gut microbiota which is there in the gut, which may be due to a lot of factors, it can affect the brain in different way. And the possible disorders which have been associated because of this gut dysbiosis have been like autism, Parkinsonism, mood disorders, and even the ASDs. So in today's focus, we'll be mainly focusing on ASDs and how and its association with gut dysbiosis. So this is very interesting literature which I got it. Now in 1943, way back in 1943, Mr. Kenner, he found that 6 out of 10 children with autism presented with severe GI symptoms. And interestingly, what he found that the frequency of these GI symptoms was maximum in ASD, followed by developmental delay children, and which was least in a neurotypical child. So this was the study which is found way back in 1943. So we can say that the relation of association with these GI symptoms with autism is not new, and it has not been that which is not being studied in the past. It has been studied in the past, and a lot of literature is there. Now, then the question comes, why we want to study gut in autism? The reason why we want to study gut in autism, and there has been a lot of, our approach towards treating autism has changed in the recent past. We are more towards gut healing. We are more towards looking towards the gut microbiota. We are more towards the new terms of gut dysbiosis and etc. The reason is because the incidence of GI issues are very, very high. As I've told, it is around 20 to 25%, which is quite high. And again, the relationship of gut and brain axis. In a very simple term, if the gut is bad, the ASD symptoms can worsen. So means bad gut increases or worsens the ASD symptoms. It doesn't cause, but it can worsen the symptoms of ASD. So, what are the important GI comorbidities which are there? So, they have taken the literature across 144 autism studies which have been done, and what they found that the maximum percentage was of nausea and vomiting, probably because of the reflux, then constipation, other than diarrhea, abdominal pain or discomfort, bloating issues, or it may be any of the above symptoms. So, these were the most common symptoms which they found have been associated with autism as a part of GI spectrum. So, what we know about human gut. Before going to the gut dysbiosis, let's discuss something about human gut and how amazing it is. So, the human gut basically compromises around 1 kgs of bacteria, and this approximately accounts for around 9.9 million. So, you can imagine the amount of bacteria which are there in the human gut.
Voice is breaking, sir.
Yes, in fact, I'm seeing a freeze also on doctor's side.
That and if you go to the ratio of the DNA of the human
Doctor, there's a lag in your audio, and yeah, I think he has a network issue. Please hold on.
is it okay now?
Can you speak something for testing, doctor? Please hold on, parents. I think doctor will be back. Yeah, let him rejoin. Join back.
Is it okay now? Is it okay? Am I audible, Ms. Dipamita?
Yeah, you seem to be, the audio seems to be better. Can you start sharing your screen and speak? Let's see.
Yes,
Yeah,
yes.
yeah, yeah.
Now it is okay?
Yes, yes,
Yeah,
quite good. Yeah,
yeah.
yeah, yeah.
Okay.
Please carry on. Yeah,
So I think there were some network issues. Anyhow, we'll
yeah,
resume now. So
yes,
coming to the
yes.
human gut now.
Yeah, we
So I
can
was
repeat
talking
this.
that
Yeah,
the ratio of the host DNA versus microbiome DNA is around 1 is to 10. That means we are just 1/10 of a DNA compared to the microbiome DNA. So it's we can really imagine that we are more of a bacteria than a human body because the human body is more or less dominated by the bacteria. So this is the amazing human gut that we humans are having. So basically, before going to the gut dysbiosis, we would know these terms because these are some of the very important terms we should know and understand. What does these terms basically mean? So what is a microbe? Microbe is basically defined as microorganisms which are present in the human body. Now, most common ones are the bacteria, viruses, and human body. It can be present in anywhere, either in the stomach, either in the intestines, either in the mouth, so any part of the body. So, what do you mean by microbiota? It is a collection of these microorganisms at a particular site in the human body. So, if we talk about microbiota in the intestine, we means that the collection of these different type of microorganisms in the intestine specifically. So, microbiota defines the collection of microorganisms on a particular site. Then what is this microbiome? The microbiome is defined as a collection of the genetic material of these microbes. So in very simple terms, it is the genetic material of these different compositions or the microbes in the human body, whether it is a virus, whether it is a bacteria or etc. Now, this microbiome is very, very important and it plays a very important role in modifying, and its genome gets modified through our health, through our diet, hygiene, and genotype. So, it's basically mean to say that the human microbiome and the host microbiome interact in a vice versa. If we eat healthy, the human microbiome will be in a good condition. If the human microbiome worsens our body or its composition get disturbed, our health, our diet, hygiene, our composition also gets disturbed. So this is the important. And on the basis of this, we will be discussing the gut-brain axis or the gut-brain theory or the gut dysbiosis. So what is this role of gut microbiome? Now, these bacteria communicate with each other as well as through the host. They are important sources of nutrients, vitamins. They can influence the host gene expression, as I've told in the previous slide. They also play an important role in maintaining our intestines. Good hemostasis means to say keep our gut in a healthy condition. And the gut-brain communication. Now, this gut-brain communication is the one which we'll be focusing in the presentation today. So, what does this dysbiosis means? Am I audible?
yes, you are. Yes, you
Okay,
are. Now
okay.
the flow is
So
good. Yeah.
what basically dysbiosis means? Now, dysbiosis, if we talk, is basically termed as a detrimental discrepancy in the composition of these bacteria, which has been linked to chronic, systemic, and immune disorders. So, in a very simple way, or in a layman term, if I describe dysbiosis means we have a composition of good bacteria and bad bacteria which live in a harmony. Now, when these bacteria get disturbed or their harmony gets disturbed, maybe due to a lot of reasons, maybe due to antibiotics, maybe due to stress, maybe due to XYZ factors. When these balance of good and bad bacteria get disturbed, it causes the disturbance in the gut microbiota, or what we call as gut dysbiosis or dysbiosis of the microbes in the human body or the gut. Now, dysbiosis can be caused by frequent or irrational use of antibiotics. It can be due to anxiety, it can be due to genetic factors, or it can be environmental factors. Now, recently, our approach has turned towards from genetics towards to more of epigenetics. Now, what does this epigenetics means? Now, epigenetics means the environment, the surrounding, which can affect the gene expression of a body. Means to say, if the mother is conceived and she is during a pregnancy, and she is not being as having any genetic disorders, she is not having any infections, but she is having a lot of physical stress, she is having a lot of mental trauma, she is not taking a rest properly. Now that part what we call is epigenetics, and that can influence the host gene expression, that is the mother, which in fact can disturb the gut microbiota of the mother, and then comes starts the cycle of ASD. So means to say this whole gut dysbiosis starts right from the period when the mother conceives or when the child is in the womb. So we'll be describing this in the future slide how exactly it happens. Now, furthermore, dysbiosis has been strongly associated with autoimmune disorders such as Parkinsonism, asthma, malnutrition, inflammatory bowel diseases. So we'll confine our talk towards autism only in this slides. Now, this dysbiosis also disturbs the intestinal permeability, what is called as leaky gut. Now, we as parents, as professionals, must be very familiar with this leaky gut. We must be hearing a lot of things about leaky gut. Leaky gut होता है बच्चों में autistic में gluten casein का problem होता है. So this is one of the factors which can cause the leaky gut, as a result of which the metabolites or the breakdown products of gluten or casein, what we call, they passes through these breakdown products or through the leaky gut along with this metabolite toxins, which through this leaky gut enter the brain through the gut brain axis, and the whole picture or the behavioral symptoms of ASD gets worsens. Now, what are the causes of leaky gut? Now, these are some of the causes which I have mentioned, but the list is endless. And you mention any cause, it could be can cause leaky gut. Even a mild stress, even your negative thinking can cause these things. So that is why we talk about epigenetics, because most of the times we see that in spite of there are a lot of syndromes have been associated with autism, but the known syndromes hardly through which we can diagnose them are hardly 2 to 3%. Rest are those which we cannot diagnose, which we don't know, and we cannot make a diagnosis of that. So that is why we talk about epigenetics. That is the modification of your lifestyle can affect the gene expression of you. So to mention a few, like impaired immune responses to gluten and casein if a child is intolerant to them, or if there is a deficiency of omega-3, or there is a stress, antibiotics, altered gut microbiota, the mode of delivery. Now the type of delivery is very, very important. And obviously the junk food. So nowadays we also see that if a child is having a cough and cold, and nowadays it's not the problem. We as parents also are very, get stressed out. If a child gets a fever of 4 to 5 days, without thinking, we'll immediately start with an antibiotic. Even if the doctor doesn't suggest, because even if a normal viral fever, it takes at least 5 to 6 days. But because of so much stress in the life, because of so much fast, we also get panic. We don't want to wait for that period of 5 to 6 days, so immediately start with the antibiotics. So those irrational use of an antibiotics somewhere in our life can disturb these pictures of gut. So what happens when these, now coming to dysbiosis. So as I have told in a very simple terms, that dysbiosis means the balance between the good and the bad bacteria get disturbed. So on the left hand side, there is a normal gut, and the normal gut, if you can say, it is predominantly dominated by lactobacilli and bifidobacteria. Now these are considered to be the good bacteria which help in keeping our body in the healthy state. Our gut keeps in a healthy state, helps in normal functioning, absorption, and etc. and etc. But when the gut gets dysbiosed or the microbiota gets disturbed, you can see the predominance of lactobacilli is so less. The blue ones which have been mentioned are being marked as lactobacilli. So you can see the numbers are hardly very less. And compared to the other ones like Streptococci, Protease, Yersinia, these are all considered to be bad bacteria. And there have been a lot of studies which have been done where they have done the RNA genotype expressions and the fecal matters they have taken, where they have found that the gut of the children in the spectrum is very less, containing very less amount of bifidobacteria and lactobacilli compared to other species of bacteria. So through our research and through the literature, we can say that the gut of the children on autism spectrum, they have very less amount of lactobacilli and bifidobacteria, which are considered to be good bacteria in a neurotypical or in an autistic child. Okay. So because of the leak of these toxins through the gut, they reach through the brain, through the gut-brain axis, which we can worsen the behavioral symptoms of ASD. And evidence have found that there are 10 to 12 specific strains of lactobacilli and bifidobacteria, which are deficient in majority of the ASD kids. As I was telling, that these are the one species which are found to be deficient in majority of the kids of ASD. So then coming, what are the factors which affect the gut microbiome? Now, this is very important to know that we have talked about gut dysbiosis, we have talked about gut, we have talked about microbiota, microbiome, but what exactly are the factors which can disturb this gut microbiome and which can ultimately lead to gut dysbiosis? So our knowledge of this has excessively increased and expanded over the last few years. Now, initially we thought that the in utero means the, in a simple term, the uterus environment, or when the child or the fetus is in the womb, it is sterile. Sterile means to say it is non-infectious. So there was a, so we were thinking that no matter whatever the type of delivery is, the child born will be completely sterile, will be non-infectious. He will be in a completely clean or sterile environment. But this is not. Exactly, this is not the thing. So the recent research and literature shows that the way the child is delivered matters a lot, and that can affect the that can affect the gut microbiota of the child. So we have found that those children who are born through a normal deliveries, their gut contains good bacteria compared to those which are born through a cesarean. Why? Because when they are born through a normal delivery, the mother's microbiota gets automatically get transferred through the normal delivery into the gut of the children. So they have been exposed to the same. But when the child is born through a cesarean section, most of the microbiotas which have been found to be in children are more of those which are present on the skin and which are not of considered to be a good. So in a simple word, going for us children who are delivered through CS, there are high chances of disturbance in the gut microbiota compared to those which are born through normal delivery, but doesn't mean that CS children will develop ASD. Now, again, what are the factors which disturb the gut microbiota? In So I was talking that this gut microbiota starts right from the child when the mother conceives. So here, what are the factors which disturb the gut microbiota of the mother? So very important is maternal diet. Now, it's basically our ancestral thinking, and we have an orthodox thinking that अच्छा खाना खाओगे, high fat चीज खाओगे, तो आपकी डाइट अच्छी रहेगी. तो मदर को बहुत घी दिया जाता है, बहुत बटरी चीजें दी जाती हैं, बट एग्जैक्टली दिस इज नॉट द फैक्ट. द थिंग इज she should take a balanced diet. A balanced diet means you should have a good amount of carbohydrate, fats, proteins, but in a balanced ratio. This balanced word we always miss. We just feed him with a good fat diet, heavy diet. अच्छा खाएगी, but it's important that you should have a balanced diet. So high fat maternal diet has been considered to be one of the most important factors which is altering the gut microbiota. And then diet low in iron. We generally forget about consumption of iron, and iron and calcium are one of the most important factors which can reduce the incidence of neural tubal defects in children, neural tube defects. And I won't go into those things because these are beyond the scope of the present presentation. So, but these are the factors which disturb smoking, antibiotics, stress. These are the factors which I was talking related to epigenetics, alcohol consumption. The life is such that it's difficult to tell that exactly what percentage of mothers would be taking consumption of alcohol, but yes, in the present scenario the consumption has increased, and these are some of the factors which have been associated with those. Less consumption of fiber diet, we are more towards western style. We are, most of us are working, so we are, we, because of the shortage of time, we are consuming more of a packed food. So that is again a factor which is responsible for the consumption of fiber diet. Now, all these factors, the factors which I have mentioned here, causes the activation of the maternal immune system, what we call as MIA, maternal immune activation. Now, when this maternal immune activation happens, it causes the release of some important, I would say, inflammatory markers, or in a simple term, the markers which can increase the infection or can cause inflammation, or in a simple word, can cause swelling. So these are some of the markers. It's a little technical, so we will just want to know that it causes an activation of maternal immune activation. Now, what are other things which can disturb? Other one which I have told, like mode of delivery. Now, there have been a lot of studies have been gone which have shown, as I was telling, that children who are born through a normal delivery, their gut remains in a good healthy state compared to those children who are born through a cesarean section. So I won't go into the details of these literature and studies, but the crux is that children born through a normal delivery, they have a good gut microbiota compared to those which are born through a CS. Now, another important factor which is very important to discuss here is breastfeeding versus formula feeding. Again, it comes related to epigenetics. The lifestyle is such that the mother has to run to the office. She's running short of time. She has to run. She has to report to his boss at 9 o'clock. The child here is crying. The grandma is shouting at the back. The whole scenario is happening. So those are the things which basically affects the even the feeding, and ultimately we are forced to switch to a formula feed. Now, but without unknowingly, the formula feed happens to contain very less amount of HMOs. Now, what are these HMOs? These are in fact considered to be some type of oligosaccharides which are considered to be having good amount of good bacteria, lactobacillus and bifidobacteria. So in a simple term, I would say breastfed children will have good amount of lactobacillus and bifidobacteria which are considered to be good bacteria and which can make the gut of a child healthy as compared to children who are on a formula fed. Why? Because there the HMOs, or you can say the lactobacillus and bifidobacteria species, are very less. Nevertheless, nowadays many of our companies, they are trying to make the formula feed as close as possible towards the breastfeed, but we cannot achieve this amount of HMOs and we cannot achieve this amount of lactobacillus and bifidobacteria which are naturally present in the human milk. So this is the fact that going for a formula feed will definitely affect the gut microbiota of the children compared to the breastfed mothers.
ഇത് വന്നിട്ടെങ്കേ
Now, these are some of the studies which I have shown that relation to the gut dysbiosis and what are the various types of bacteria which have been found to be high in children with autism spectrum disorder compared to those in a neurotypical. So I won't go into the studies, but you can go if you want. I have mentioned these studies. So these are some of the, and among them, this is one of the Indian studies which was also done in AIMS. I think I have not mentioned here. So these are some of the studies which prove the role of gut dysbiosis in ASD. So now coming to this is a small graphical representation to just to make you understand that maternal immune activation, as I've told, which can be occurring as a result of antibiotics, stress, epigenetics, and etc. and etc. That can disturb the bacteria in the moms, or you can say the mom's gut bacteria can disturb, and because of these factors, which can happen due to plenty of reasons. It can be maternal, it can be due to delivery complications, it can be due to advanced maternal age, it can be due to stress, epigenetics. So the list is actually endless. But all these factors, when it happens, it can trigger the precursors in children and can result in symptoms of ASD in future life. But the thing is that the precursors of ASD are formed well before the child is born, right in the womb. But unfortunately, as of date, we don't have any test which can confirm that yes, this child who is born will have a risk of ASD. Probably because of so much research which is going on ASD right now, I won't be surprised that in near future we develop some screening test that should be mandatory for every newborn who is delivered globally to go for a screening test for ASD. Right now we do a screening test on the basis of MCHAT, but that is done at least at a minimum age of 9 months and then at 18 months. And we cannot make a diagnosis of ASD, a confirmed diagnosis of ASD, at least before the period of 18 to 20 months. So this is the period where we are lacking, and as a result, we are not able to figure out the ASD symptoms in children before the age of 18 months because we have an attitude of neglect. Doesn't matter, बोल लेगा बच्चा अभी नहीं बोल रहा है या चंचल है या बाद में बात कर लेगा. So we have an attitude that चलो कर लेगा. But by the time he reaches the age of 2 years, he is starting lagging behind as compared to his peers. And then our mind gets strike that something is going on. Then we'll be running here and there, we'll be running to the pediatrician, we'll be running to the psychologist. But the problem is not our, but the problem is we are not able to pick up these symptoms of ASD early. And frankly, we can pick up the symptoms of ASD as early as 6 months. In our previous webinar, I have given a webinar recently also on this socialization skills in ASD, where I have mentioned there is one thing what we call as imitation. Now, imitation is one thing which is lacking in children in ASD. So we can pick up that imitation as early as 6 months. So this is the thing that we should get more and more aware about ASD and these factors. So coming to the present thing. So what is gut-brain axis? Now, gut-brain axis means a connection between the gut and the brain. Now, this connection is bidirectional, mean to say, if the gut is healthy, the brain will remain in a healthy state. But if the brain is disturbed, it will also disturb the gut. So that means to say it is vice versa. If you are healthy, I will keep the brain healthy. If the brain is disturbed, I will not keep the gut healthy also. So they remain in a harmony like the good and the bad bacteria. So, and the gut is considered to be our small nervous system. The brain is the main nervous system. The gut is considered to be a small nervous system, which is called by the name enteric nervous system. So enteric means intestine or the gut. That is why the name has come. So the gut-brain axis consists of a bidirectional communication between the enteric nervous system that I was telling, linking emotional and cognitive brain with peripheral interfunctioning of the gut microbiota. Now this gut and brain is connected through the nerves, it is connected through the neurotransmitters, and it is connected even through the various chemicals, that is the neurotransmitters or the nerves and the hormones. Now, changes in the gut can affect the brain. So, we'll be discussing now this slide. I'll just get the full slide on the,
Okay.
yeah. So before describing, now this slide describes the complete gut-brain axis, how it is related and how it causes the symptoms of worsening of ASD. Now, before going into this detail of the slide, I'll just tell you what does synaptic pruning means, because this is very important to understand. Now, pruning means, or synaptic pruning means, we have heard that there is a very common term which we talk about in our social media, and those parents who are connected through the autism groups and social media, defective wiring. बच्चे की वायरिंग डिफेक्टिव है. Now defective wiring means that उसके जो connections हैं वो proper नहीं है. In a simple way, for example, if a current is flowing from circuit A, B, C, D in a neurotypical child, in an autistic child or a neurodiverse child, it will be flowing from, rather than from A, B, C, D, it will be flowing from either from A, D, C, B. But the connection is not smooth. So these connections which are not smooth are present in every neurotypical child when he is born. That means there are endless number of connections which are there. But by the age of 4 to 5 years, these unnecessary connections which are not required, they get gradually finished off or weaned off or die off. And only some specific connections remain in the body or in the brain, which help to carry out more functional, complex, and intellectual functions. Means to say, suppose I will give you an example. Suppose a 5-year-old child is standing and you tell him, get me a glass of water. A neurotypical child, for example, you just give him a command, he will run within seconds and get you a glass of water. Whereas a neurodiverse child who is on the spectrum, he will wait for a second, he will understand what was the command was given, and probably he might get that after 2 to 3 minutes. If another child who is on the spectrum, he might wait there, he might, the command will go over his brain and he will not be able to understand what was the command was given. So in that case, we have to give him prompts, we have to give him a lot of things, visual or physical prompts, ultimately he might get. So what is happening here? Here it is happening that the synaptic pruning has not happened, because the connection are so unnecessary connections are there in child B, and in second and third child, he gets confused. So means to say that by the age of 3 to 4 years, these unnecessary connections get finished, or they get die off, what we call as autophage, or they get die off, so that only some specific connections are there which help to carry out our functions fast, smooth, and in efficient way. This is what we call as synaptic pruning. That is removing of unnecessary connections which are there in the brain to help to carry out more smooth and effective functioning. Now, this synaptic pruning doesn't happen in the children who are on the spectrum, or it is not functioning smoothly. As a result, they get confused even with a simple command. We have to give them a lot of prompts. They have to repeatedly again and again, we have to give these things. So taking this thing behind, we'll discuss this slide. So now gut dysbiosis we have discussed what are the factors which causes gut microbiota. Now when these factors of gut dysbiosis happen, the bad bacteria, they releases lot of toxins. Now those toxins along with this leaky gut can be tumor necrotic factor alpha, it can be interleukin 6, means to say they release lot of toxins. And along with that, there are some metabolites are also there, like short chain fatty acids. They are also produced through this gut or through the release of these bacteria during the fermentation process of these. Now, these short chain fatty acids also promote the release of neuroinflammatory transmitters, or you can say neuroinflammatory cytokines, which are responsible for causing the inflammation in the brain. Now, because of through the leaky gut, they reach the brain, and when they reach the brain, they cause defective functioning of the macrophage or the microglial cells. Now, what are these macrophages? These macrophages are responsible for removing the excess neurons which are there in our body, which are not required by the age of 4 to 5 years. Now, this synaptic pruning doesn't happen in children with autism or neurodiverse children because of the fact that the microphage function is not functioning smooth, or it is dysregulated. And why it is dysregulated? Because of the release of these toxins, these short chain fatty acids and other interleukins, because of the disturbance of the gut microbiota or gut dysbiosis. And this gut dysbiosis happens start in the womb or during the conception period. And these all factors then crosses the blood brain barrier, causes the inflammation, causes the reduced synaptic pruning, and can worsen the symptoms of ASD. Now, worsening symptoms of ASD can be a very wide. There is it that is why it is called as a spectrum. In one child, this disturbance can cause only a lack of communication or worsening of the sensory symptoms. In another child, it can cause aggression, self-injurious behaviors. It can cause worsening of his agitation, or it can cause anxiety. It can cause sleep disturbances. It can cause gut issues. So the symptoms are so varied that we cannot basically classify that, okay, this thing will happen in this child, this thing will happen in this child. There is a saying that if you meet one child with autism, you meet one child with autism. Means to say, if you stand 1,000 children of autism in a line, there won't be any single child who will be having same symptoms of autism. That is why till date we are not able to figure out the exact treatment protocol for autism. We have to make treatment, or I would say we have to make approaches. There is no such treatment. We have to make approaches as per the individuality of the child. Now, gut dysbiosis and defective synaptic pruning. This is the synapse which this is the basically the crux which I have taken from all these slides. That gut dysbiosis plus defective synaptic pruning is ASD. Now, it's not that easy, which I have mentioned in the slide, but just to make you understand in a very simple way, gut dysbiosis we have discussed what could be the factors like maternal immune activation, stress, smoking, epigenetics, and altered gut microbiota in the mother, which can be due to depending upon the delivery, which can affect the gut microbiota in the child depending upon what type of delivery the child is been delivered, which affects the gut microbiota in the child. This gut dysbiosis then cause the release of neurotoxins, interleukin, and etc. There is a release of short chain fatty acids, which further releases these toxins, or what we call as neuroinflammatory, or which can cause a swelling of the brain, which in fact then cause the disturbance of the macrophage functioning, which in turn causes the defective synaptic pruning. Ultimately, we land up in children developing symptoms of ASD. So this was a brief about ASD, gut dysbiosis, and its association. So we'll be directly moving on to the question and answers, and I will hand over to Ms. Dipanvita. Ms. Dipanvita, please kindly do the proceedings further.
Yes. Thank you so much, Doctor. A lot of good learnings, especially the part that how early it starts and passing on from the mother to the child and all those insights. It really, gives a lot of insight into this topic. Thank you so much for that. In fact,
Thank you.
before the parents can start engaging with us, I'll call out the names one by one. In fact, I had this question which you already addressed, that how soon can we know about this? Is there a scan or is there something? But I think you have already covered that, right? So yes, so we will take question from the audience. Just a second. Yeah, raised a hand. We'll just go. Yes, Vivekananda, you can unmute yourself and ask your question, please.
Thanks for this session. It was much informative, at least on more on a technical front, what is happening. But Yes, on a later stage only we could able to know such symptoms, and after that we are taking some measures. My child, the age is at 9, so okay, a lot of things were happening. We could able to detect only at the age of 3 that he is having few challenges, and after that he is now at 9. But okay, still he's having few challenges, like he could not able to sit at one place, and he could not able to make the eye contact properly, which is also disturbing him the sitting tolerance, which he could not able to do it at the class, but he's good at academics. So what could be a suggestion from you that we could able to know what went wrong, or what could have been these causes which is today it is happening, but what could be the remedial, what you can suggest me, sir?
Uh, See, what could be the causes is very difficult. The list is endless. Now that the child is ASD, now he has having this issues. We should be more in terms. We could now think what are the remedial measures what we can do rather than going retrospectively and figuring out the cause, because that is practically not possible. So unless and until if there is some associated genetic disorder in the family or in the siblings. So right now the most important thing, see, on the basis of this short history, it is very, very difficult to comment that what is sensory profiling. I'm not a sensory expert, but there is a one thing what we call about sensory profiling, which we have to do a complete sensory assessment, taking into consideration the proprioceptive, vestibular, and etc. parameters. So depending upon those things, you need to figure out how is about his sensory system. Then along with that, you have to figure out what about his gut issues. Along with that, you have to figure out what is his level of communication, how much he can communicate, how much he cannot communicate. So taking into those parameters, we have to work along with an therapist, looking into sensory parameters, looking into speech parameters, looking into the gut parameters. So it's basically an holistic approach. We cannot go in one direction that, okay, we'll work on this. And now the most important, the primary, the most important things we always lack is eye contact, imitation, and joint attention. These are the three fundamentals which are very, very important and lacking in 99% of the children on spectrum. We are more towards goal achieving. Oh, this child is 4 years. I have to make him understand ABCD. I have to make him understand 1 to 100. No matter if he's not giving an eye contact. That is actually a wrong approach. We have to work on the basic fundamentals of this eye contact, joint attention, and imitation. If we work on these parameters, we'll definitely the child will able to overcome all this. So my suggestion would be, initially, since you have told that he is not having an eye contact, work on his eye contact, work on his imitation. I believe his imitation will also be poor. So work on these three parameters, in touch with your OT, in touch with your therapist, or you can get in touch with us, as we are also working on all these parameters.
Only one thing, sir, you talked about the sensory profiling,
Yes.
which probably occupational therapist can little bit touch on that, what could be
So,
his issue and see.
sensory profiling can be done by not exactly by an occupational therapist, but he should be certified in sensory integration. A sensory integration is more of a matter of concern that is important. So, get in touch with an OT who is certified in sensory integration and who is having a knowledge of that. And if you are not able to find, you can also get in touch with us.
Sure, sir. And another one method you told, no, this gut, I could not able to fully. You told about the second point. We need to assess his gut.
Gut issues, language, communication, oromotor issues. There are a lot
Okay,
of
is the
things that
gut
the
issue?
child.
Any test is there, sir? Any test we need
No,
to
no,
do
the
it?
test is not there. Assessment is there.
Okay,
Okay.
gut issues. Okay, right. Okay, sir. Thank you. Thanks for this
Thank you.
suggestion, and we will take it up forward, sir. Thank you.
Thank you. Thank you.
Okay, so we will come to next question. Swapna, you may please unmute yourself and go ahead with your question.
Hello, doctor.
Hello.
My question is also related to gut. So
Yes,
you
ma'am.
talked about the good
Ma'am, could
bacteria.
you could you please speak little louder? Your voice is.
There's some
Uh,
background noise, so if you speak louder, it'll be easier to
can
catch.
you hear me now?
Yes, yes. Please go ahead.
Okay. So you talked about the good bacteria
Hmm.
during a normal delivery and while breastfeeding.
Yes.
So, what in case the baby is not through normal delivery? Is there any other way that we can expose a child to the good bacteria?
Is there any?
Any
Any
other
other
way
way?
to expose the child to good bacteria?
Exactly, exactly. Here comes the role of psychobiotics. Now, what does psychobiotics means? Now, what we are doing right now, we are basically going towards gut healing, as I was telling in the presentation. Psychobiotics are basically specific strains of live bacteria. Live bacteria means probiotics. There are two terms which are most commonly used, like probiotics and prebiotics. Prebiotics means it is a feeding material. We are just giving the feed into the gut, and the bacteria will take up and they grow in number. So in that case, that feed will be a common feed for the good bacteria and bad bacteria. So we don't know, there might be a vaccine and waning phenomena. Sometimes the gut may disturb because of the increase in bad bacteria. Here what we give is psychobiotics, or good live bacteria, or probiotics. Now these probiotics which we are giving, they are specifically those good bacteria which are found to be lacking in majority of the kids in ASD. So we are basically giving probiotics in terms of psychobiotics, which are containing good bacteria.
Okay, okay, doctor. And one more question. So, for example, is it applicable only to children of certain age, or for adults also we can give probiotics?
It depends upon, these are psychobiotics which should not be recommended or should not be given as a routine in a neurotypical or a neurotypical adult, because see, there are a lot of probiotics available in the market. I just tell you, take a probiotic, you will get hundreds of probiotics in the market, but that is not the concern. The concern is what is the dose, in what colony forming unit they are present, and what type of species is present. That is most important, and taking into consideration we are giving that specific psychobiotics.
Okay, doctor. Thank you.
Okay.
Because the reason why I asked regarding adults is because I believe this gut infection is also the reason for autoimmune diseases. So I thought if it
It
is
is one
applicable
of the
for.
reason. It's not the only and the sole reason. It is one of the reason.
Hmm. Okay.
Okay.
Okay, doctor. Thank you.
Okay. Thank you.
Thank you. Thank you. Doctor, while we are on this, I'd like to pick up a related question from the chat, where Rashmi is asking that do probiotics help? And can you name a probiotic?
Yes, probiotics do definitely help. Probiotics definitely help. And there was a recent literature, and there was an article in 2020, in fact, in June 2020, which there was an RCT study. If some of the parents are from the statistical background, there was an RCT, or randomized control study. And there are a lot of studies on probiotics which are found to be improving the symptoms of gut, along with the gut sensory issues and core symptoms like behavioral issues and etc. and etc. The probiotic which I'm using is basically a 12 to 13 strain probiotic, specifically containing lacto and bifidobacteria, and it comes by the name Brain Biome.
All right.
Can you name it again, please?
Yeah,
What
yeah.
is the
I'm
name?
just typing out the name in the chat.
Thank you. Thank you.
Yeah,
Can I
yeah,
say something, please?
yeah, yeah. May I know your name, ma'am? I'm not able to see that.
My name is Rashmi Handa.
Rashmi, okay, okay. Your question only. Yeah, please go ahead. Please go ahead, Rashmi. Yeah, yeah.
Doctor, I don't know whether it is understood by the medical fraternity, but still, my son is now 45 years old. He has been on the syrup Gelusil or Algel or Digene for the past, I think, 30 years. And if I stop it, he stops eating. So I just continued with it. Now for the
If
past
you stop
15
it, if you stop it, then
he stops eating. He doesn't eat as much as he should for a normal
see,
child.
ma'am, Gelosil or what Digene you are giving probably because of the reason of acidity. And as I mentioned, that acidity, reflux issues, gastritis are very common in children with spectrum. Now, is your child on spectrum, or is a neurotypical?
He is autistic, sir.
He is autistic. So
Yes.
see, ma'am, that could be a one thing that could give him a relaxation in terms of reflex issues, in terms of gastritis, because no doubt, as I have shown in the previous slides, gastritis, gut issues, constipation, diarrhea, bloating issues, these are one of the most common symptoms which are present in children with gut issues. So
Yes.
definitely giving that antacid will give him relief to some extent, but it's not that we will be able to recover those core features or other parameters of the spectrum.
Okay. I'm not worried about the spectrum part of it. It's
Exactly.
something that he is. It's okay. It's part of him. I've been also giving him Visilac for the past, I think, 3 years. Is it helpful?
I would suggest you to kindly continue with that.
Okay. Okay. What about the name that you have given, doctor? Is that better?
Right now, since the child is already 45 years age and
Yes.
he's settling on that grounds where you are giving those medications, so I won't suggest you to make an experiment at this particular age.
Okay.
Because
Okay.
doing something different at this age, if something goes wrong in the terms of his hyperactivity, sensory issues, it will be disturbed for everybody. So
Yes.
kindly continue with that, ma'am, which you are continuing as of now.
Okay. Thank you, doctor.
Thank you.
And your autism doesn't bother me at all. Thank you.
That's
Thank you
great.
so
So
much.
nice of you.
So nice to talk to you, Rashmi ma'am. Thank you.
You're welcome.
Okay. We'll take up the next question from Abhirami. Abhirami, can you unmute yourself and ask directly? I can see the hand raised, but okay. Meanwhile, I'll look into the chat.
Hello. Hello.
Yeah, she's there.
Yes, yes. Hello,
Yeah,
ma'am.
yeah.
Yes, sir.
Please.
Very good evening. Thanks for all your information. My kid, he is 10-year-old. He's in spectrum. He is able to communicate. As of now, he's picking up in sentences. My question is this: Can I haven't given any probiotics or prebiotics till now to my kid, and can a 10-year-old? He has turned 10 now. Can a 10-year-old will get benefited by starting probiotics at this age? Is it like kind of late? Or will it have, as you mentioned in the earlier call, will it,
Definitely benefits will be there, but again, it depend upon what type of symptoms is he having. Because those symptoms can vary right from they can be yeast issues, they can be simple gut issues. Now, means to say, just to give you some example, is there any uncontrolled laughter? Is there humming? Is there any sleep wake-ups in the night? Does there a lot of bloating issues, gut issues?
he
Do
has
the
gut
child have
issues?
constipation?
No major symptoms as of now. I would say, okay, the usual like lack of attention, communication, or social withdrawal that is there. But then
Yes.
this, as you mentioned, that with his gut, he goes for he frequently goes for toilet. That is my so will that will be addressed by and
Exactly,
that
exactly that will be addressed, because ultimately, indirectly, uh, in some way or the other, some amount of toxin will be passing through the gut-brain axis that might be causing a disturbance in his behaviors or sensory or withdrawal. So
okay.
definitely giving probiotics to some extent will help, but yes, the fundamentals of therapies like occupational therapy, speech therapy, sensory integration has to be worked upon together along with these.
Okay.
But giving
So
a
one more.
probiotic as such will not cause any harm.
Okay, sir. Fine. Sir. Thank you, sir. One more thing, sir. This, as you mentioned in the slides, the leaky gut, which is being mainly passed on through this casein and gluten. I mean, is it like this as GFCF diet will really help them if I go in for casein
See,
free?
I don't know, ma'am, if you have attended any of our webinars. There was a recent webinar on food and autism where we talked
Okay.
about rationale of using GFCF diet.
Okay.
Nowadays, we are so much connected to social media. If one child starts on a GFCF diet, mother says, "मेरे बेटे को तो बहुत जल्दी आराम मिला," you also start. That is not the criteria. There is a simple thing. You have to look into the clinical picture of the child. We have to go into the food intolerance test depending upon what is the level of intolerance, because there are different levels of intolerance. Here we are not talking about allergy. Allergy goes through a name by IgE. We talk about food intolerance, which measures IgG. So they have to check the levels of intolerance, whether it is in a mild, moderate, or severe. Now, depending
What
upon
is it,
that,
sir?
we have to restrict
IgG.
what has to be given, what not has to be given. So just
Okay.
blindly following a GFCF diet is not rational approach.
Okay, sir. What is it, sir? Sorry, sir. Can you come again? What is it? Food intolerance test? IgG.
Food intolerance panel test that can be done all over India through the Dr. Lalpath, SRL lab, or Thyrocare.
Okay. Could you please ping the details of what is
I
food?
think Ms. Dipanvita, can you write it on
Yeah,
the
I'll
chat
write
box?
it. Yeah. Will
Please,
you just
please.
repeat it
I-
once, doctor?
Food intolerance panel test. Food, F-O-O-D, food intolerance panel
Intolerance.
test.
The third word?
Panel,
Panel,
P-A-N-E-L.
panel. Okay, okay, panel. I was not getting that word. And you suggested some centers where this can be. Oh, sorry. Once again, you suggest food intolerance.
The major labs which are there, Lalpak lab, SRL, and Thyrocare.
Okay, thyroid. Can you name that the other one? Lal something you said, no? Lal
LAL, Lalpak, SRL, SRL.
SRL. Okay, these are the places. Okay, I've posted it to everyone.
Thank you.
Since you've come up with these the details, I just have one more doubt along with this. The deficiencies, the mineral deficiencies, could also be taken up through these labs. Will that also will be useful?
See, that
Like,
depends. See, those deficiencies, if you go for those deficiency, hardly I will see that less than 10% of the children with spectrum will be having those deficiencies. Generally, we
yeah,
go for the
right.
zinc
Okay.
deficiency, we go for iron deficiency, we go for copper levels. That is not the thing.
Okay.
We generally go in those cases if the child is a picky eater. Now, picky eater is a term which is more commonly used in children with
Yeah,
spectrum. Why they do have picky eating? Because they will be choosy for a particular texture of food because of the
right,
oromotor sensory issues. There'll
right.
be neophobia. They don't want to taste the new texture of food. There'll be tactile defensiveness. They won't be able to touch the new food on the tongue. So those are the things. If you feel your child is piggy eater, he is sensitive to only particular texture, then I would suggest you. Otherwise, if he's taking a normal diet without any issues, I won't suggest to go for those tests.
Okay, so fine, sir. And
Okay, thank you.
so this GFCF, this but only with respect to food intolerance test,
Yeah,
depends on
it has
what.
to be started with respect to that and taking into the clinical picture when you get in touch with a doctor or your anybody. But those are the parameters. Accordingly, we can start with that.
Okay, last one, sir. Sorry, sir. Poor oral hygiene.
Hmm.
You'd mentioned. So is it like, does it refer only to the brushing, or what is it,
No,
sir?
no,
Can
I'm
you
not
please?
mentioning poor oral hygiene. I'm mentioning oromotor sensory issues. Oromotor sensory issues means oromotor sensory system of the child is disturbed. Means to say he will be taking only yellow dal. If you introduce black dal into his mouth, he will be like, he will be start vomiting. He will be start spitting because that sensory system of the mouth is not that much matured enough or developed that he can taste the different textures of the food. That is why they will be very choosy to go towards that yellow dal, that particular texture. If they are crunchy, they will be taking that spicy and achar throughout the day without having a soft like khichdi and etc. So
Okay.
those things, and because of these parameters, child will have difficulty in spitting, blowing, sucking, and unless and until we don't achieve these basic preliminaries of speech, we cannot develop speech and language. So for this
Right.
thing, you have to work with an oral placement therapist who technically looks for oromotor sensory issues in the mouth.
Okay. Okay, sir. Okay, fine, sir. Thanks a lot, sir. Thanks. That
Thank
was
you.
really informative. Thank you so much.
One second. Thank you, Abhirami.
Thank you,
I'm
ma'am.
just
Thank you so much.
yeah. Someone is joining in. Just give me a moment. Yeah. Okay. Now we'll come to the next person who raised hand is Venkat Akanksha. Yes. Please
Hello.
go. Yeah.
My son is 6 years old. Actually, we diagnosed him at 2.2 age. Since then, through which I found his sleep was much more better. Sir, for this probiotic, should I have to do any test to start probiotics, or can I use any probiotics, sir?
That's what we have discussed, that using any probiotic will not give any, I would say, rational approach. First of all, you can go for, there are some tests are there which you can go in relation to looking for the gut dysbiosis. So depending upon those tests and clinical picture, you can start with a psychobiotic, not any probiotic.
What are the tests for that, sir?
That test depends upon what exactly the clinical picture of the child is there. Just suggesting you randomly to go for those tests, I won't think that will give you a benefit, but you can go for a simple stool comprehensive analysis.
Okay, sir.
Is that all from your side?
Yeah, ma'am. Yeah, ma'am.
Oh,
Sir, should I have to do some assessment and then go for the test? You mean to say that, sir?
Yes, yes, yes.
Okay, sir. Thank you. Thank
thank you. All right. So now we'll pick up some of the questions parked in the chat. It's also 9 o'clock, so we'll have the last 10 minutes. We'll go with due permission from doctor. So Dr. Santosh asks, does supplementing probiotics in later life, maybe after diagnosis of ASD, would change the disease process? One more doubt, sir, is isolated social fear or social phobia related to autism spectrum disorders?
See, first of all, I'll tell you about the probiotics, as you have mentioned, will it change the course? See, it will definitely change the course, but not it will cure the autism. Now it depends upon what is his age and how you are giving and in what dose you are giving. But definitely giving a probiotic, if the child is having gut issues, will definitely change the course of his behavior, his symptoms. In the sense, if the gut is healthy, as I was describing in the previous slides, definitely those bacteria and those toxins won't be going to the brain. So his sensory, his behaviors, his agitation, or what we call as the core features of autism, will definitely be on a lower side compared to those which are present at compared to those which are present right now in the child. So giving a probiotic will give some benefit to the child, definitely. And regarding the age, as of age, if the child is not too old, that is, if he has not crossed the adolescent age or so, then definitely giving a probiotic will be beneficial. And Ms. Dipanvita, what was
Aha,
the question?
the social phobia part. Okay. Is isolated social fear or social phobia related to ASD?
Yes, definitely. There is a theory what we call by the name anxiety issues in autism, and they have called by the name, I think I'm not remembering the name, Sage or something. There is a system in the brain what we call as the limbic system. Now, in a simple term, limbic system is the one which is associated with our emotions. And there is a three terms what we call as three F's: flight, fright, and fight. Means to say, whenever you are anxious, whenever you are happy, you will be very in a flight mode, you will be very anxious. But the problem is that anxiety and those things come directly through the limbic system, because limbic system is the one which is there in the brain, which helps to control our emotions. Now, compared to a child who is on the spectrum, if he is very happy, now his happiness will come in the form of jumping. He might throw things. He may continue laughter. He may run here and there. And we might think that he is having hyperactivity. This is actually not hyperactivity. This is anxiety. The child is not able to control his emotions in a better or in a socialized way. Why? Because his limbic system is not mature enough. So your answer to this is that the limbic system of the brain in ASD kids is not mature enough to handle these emotions at different social scenarios in a life.
All right. Dr. Santosh, I think we have answered him duly. So we'll move on because we are above time also. VJ asks, does brain biome come in any dosage?
See, brain by, yes, it comes in the dosage. There are different strains are there which mention it comes in, I think, 0.75 billions per colony forming unit. And you can give it once morning, once evening. The BD is the dose, starting right from above the age of 2 years. Before the age of 2 years, you can give it once in a day, but not recommended to be given less than 10 months or less than 1 year.
Done. So there's a question from Harish Kumar. Uh, my kid is nearly 7 and his IgE is nearly 700. We just checked last month. What could be done? He's non-verbal and no eye contact, mumbling.
As I've told that we are not concerned with IgE, we are concerned with IgG. So, and IgE just gives you an allergy. So here we are not talking about allergy to gluten and casein. We are talking about intolerance to gluten and casein. And I would say they can go to a YouTube channel. There are a lot of videos and webinars are there where they can actually differentiate between what is food intolerance and what is food allergy, because in autism we are more concerned with food intolerance.
All right. All right.
Okay.
Okay. That's fine, asking for the link. Again, a question from Rashmi ma'am. I don't know if I can ask this, but do vitamins B12 or B6 help?
This is very, very dilemma, and exactly, I won't suggest that, I won't tell that this definitely helps, but yes, giving B6 in high dose can cause some amount of improvement because they work on the concept of detoxification. Detoxification means to say that the mitochondrial functioning is not smooth enough in our body. When we are working, for example, 7 to 8 hours in a day, there are a lot of free radicals and toxins are produced. And when we go for a sleep, the detoxification process smoothens, and as a result, those free radical and toxins gets removed from our body. And in the morning, we again become fresh and energetic, calm and relaxed. But these things don't happen in a child with spectrum, and we see that if a child of spectrum goes for 5 to 7 hours of sleep, even after that he will be having same energy level, he will be having same hyperactivity, same anxiety issues. The reason for this is probably because the mitochondria is not functioning smoothly. It's not mitochondrial disorder, it is mitochondrial dysfunctioning, which is responsible for carrying out the detoxification. So giving B6 supplements along with B12 can help in making these process little bit better, depending from child to child, depending upon the clinical picture of the child. But it's not a general rule to supplement every child.
Okay, thank you, doctor. So Vivekananda has asked again, I think the first person whom we took question from, please mention the test name to identify the gut issue.
Sorry?
Please mention the test name to identify gut issues. I think
You
he,
can go for fecal calprotectin levels.
I think, should I
See,
have to?
the thing is that there are no single tests. The problem, again, I am telling, there are no single tests. It doesn't mean if the fecal calprotectin level comes out to be normal, the gut issues are not there. We have to look into the clinical picture, the symptoms, how about his food intake, how about his diet, how about his sleeping patterns, and then we have to correlate with the lab tests. Just going for the lab test and it is normal where the child is having those gut issues and etc doesn't mean that he's not having a gut issue. So you have to go in correlation with all these parameters, but to mention, you can go for the fecal calprotectin.
Okay, I think we'll wrap it up in the next 1 or 2 minutes. It's 10
Yes,
minutes
thank
past
you.
time. Thank you, doctor, for patiently taking
Ma'am,
over.
can you text that test name if you don't mind? Sorry, text in the.
Okay,
Can you
okay,
ping in the
okay.
chat, please? Thank you.
Doctor, you have to spell it out for me, doctor.
FECAL,
Hmm. Yes.
that calprotectin, CAL
PRO
PROTECTIN.
test. Done. And there's a question. Can you suggest where to get brain biome in India?
It won't be available in the market. It will be available only with the practitioners, or you can get in touch with us, or you can search on Google. If you are able to find, then that is well and good. Otherwise, because it is not locally available, it will be available only to the medical licensed practitioners.
All right. Thank you, doctor. Thank you so much. I
Thank
think
you. Thank
wonderful
you, Ms.
session,
Dipanjali.
very enlightening. So much learning. It's wonderful. It's wonderful to have you with us, with Harsha from Nutrineuron this evening. Thank you all the parents for joining us, and a very interactive session. Very good questions. Thank you all very much. Some of you have asked me, who have joined in late, has asked me for the link. I'll personally note down your phone numbers and I'll share the link. Don't worry on that. Thank you so much.
Thank you. Thank you.
Thank
Thank
you.
you, Ms.
Thank you.
Dipanjali. Thank
Thank
you.
you.
Bye.
Thank you, doctor. We'll get in touch with you. Thank you.
Thank you.
Thank you. Good night. Good
Good
night,
night.
everyone. Is Pathak Srishti? Okay. Private chatting. How come Vineet ran away?
9:15.
Ah, Vineet ran away. I think fine. There were one or two parents. I have put them back in the waiting room. They will exit in some time. We can close the room if you guys want, because it's almost 9:15 also. Or if there is anything very important, we can talk for 5 minutes and then close. Is there anything? Nidhi, Kumar, Palni?
I think we can close.
Yeah. Okay. Thank you. Thank you. Thank you. It was a very good session.
All are sitting quiet, but it was nice. The whole session was nice, beautiful, went on great. Lovely questions asked by parents.
Yes, yes. We are all very pleased to see some very well-informed and well-articulated parents.
Yes.
Because typically from remote areas, we sometimes don't get parents like this in some, but it's okay. It's we have to address to everyone.
And I felt lot of advertisement for us was done in this
Yeah,
webinar.
yeah, yeah. Actually, in last Himani's webinar also, we had a lot of advertisement for brain biome and engrossed also particularly. Though it was a little, I already had a talk with Dr. Himani. I'll update all of you later. Let's wrap it up for tonight. It's already 9:50.
Okay.
Good night, everyone,
Okay,
and
bye.
thank
Good night,
you.
everyone.
Bye-bye.